There are quite a few advances that have come over the years with regard to knee and hip replacement surgery, many of which are minimally invasive. Someone who is a candidate for joint replacement surgery usually has exhausted all conservative management options. The conservative management options include diet, exercise, activity modifications, and taking anti-inflammatory medications such as ibuprofen, naproxen, and as well as trying different types of injections such as cortisone or hyaluronic acid supplementation. Furthermore, patients usually have completed a trial of physical therapy, which also helps strengthen the joints. However, if all of these fail, then they can be a candidate for total joint replacement. There are quite a few advances that have come over the years with regard to knee and hip replacement surgery, many of which are minimally invasive. As far as my personal surgical techniques, I only make the incision as large as necessary to complete the surgery in a safe and efficient manner. Typically, in a knee replacement surgery, the knee joint is severely arthritic and the bones and the cartilage have been severely eroded away. And this causes significant pain to the patient's knee and causing joint stiffness and swelling. In order to reconstruct the knee joint, we have to remove all of the arthritic bone and replace it with a metal prosthesis seen here and here. And there's a type of polyethylene liner that allows for a smooth and pain-free joint replacement. The difference between a partial and a total knee replacement just depends on the amount of joint that is replaced. So usually in the partial knee replacement setting, only half of the joint is replaced. So whether it is the medial half or the lateral half. And as you can see, this is a total knee replacement where the entire joint is replaced. Knee replacements these days are lasting 20 to 30 years, if not longer. This all depends on how active you are and how much you use your knee. But most of these knee replacements are lasting a very long time without a need for a second surgery. After determining that the patient is a candidate for joint replacement, they undergo their surgery and they typically should anticipate a 3-month recovery time. The first 2 weeks after surgery, the patient is taking it pretty easy at home. They're following instructions given to them by their physical therapist, and they are working on gentle range of motion exercises, learning how to walk with a walker, and progressing their activities as tolerated. At approximately the 2-week mark, they come to my office and make sure that their incision is healing well and that they have no signs of infection and they are progressing as expected. The patients see me at usually the 6-week and 3-month postoperative mark, and by that time most patients are not using a walker for ambulation. They're able to return to their activities of daily life and they are not taking any pain medications at that time. Most of my patients go home on the first day after surgery, and the case manager in the hospital arranges for home health physical therapy. The physical therapist comes to your house several times a week to work with you and to start range of motion exercises and to help you return to your activities of daily life. After completion of several weeks of home health physical therapy, patients are free to engage in outpatient physical therapy as they are able to move better and start reintegrating into their lives. Here at Emanate Health, we offer an excellent outpatient physical therapy and occupational therapy service. Most of my patients, after completing home health physical therapy, are plugged into the rehabilitation services here.